So today I will be giving you a demonstration regarding the implant impression. Right? So you all know what is an implant. So after placing an implant, we wait for 3 months for second stage surgery to give a crown of the implant. So this is a dummy model where you can see the implant has been placed and over that a cover screw has been inserted. Okay, so after 3 months, what we will do? We will open the flap, we will place the cover screw, the healing abutment, and we will leave it for 1 week so that the soft tissue heals around the healing abutment. So when patient comes back after 1 week, the main criteria for implant impression is the position of the implant in the oral cavity has to be transferred the same. Okay. So the mesiodistal angulation, the buccolingual angulation, the position of the implant has to be transferred to the model. So what we will do, after 1 week when patient comes back, we will take out the healing cap from the patient mouth and we will place something called as impression post or transfer coping inside the patient mouth. So there are two types of transfer coping. One is open tray transfer coping, the other one is closed tray transfer coping. You can see the screw in the open tray transfer coping is bit longer compared to the screw in your closed tray transfer coping, the screw is in flush with the head, whereas in your open tray the screw is slightly extended. Why? The difference between open tray and closed tray, I will tell you. See, when you select a tray and when you place the open tray transfer coping, I will show you. You need to place the open tray transfer coping inside the patient mouth. This is the angulation. Then we have to select the tray and we have to make a hole in the tray so that this extension comes out of the tray. And when you make the impression, we load the putty inside the tray and light body in the patient's mouth, and we will close on the transfer coping just like we make our regular impression, and this extension has to come out of the tray. Then once the impression is set, we will loosen it and unscrew it from outside, and your open tray should be picked up or it has to come out with the impression. Whereas in your closed tray, what we do, we will fix the transfer coping. So it's there in the name itself, open tray and closed tray. In the closed tray, we will fix the transfer coping. No need of any extension to come out. We will make the impression, and once the impression is set, we take it out, and you can see there are serrations in the transfer coping. So one side it is selected, other side it is flat for the easy guidance. So once the impression is set, to take out the impression, take out your transfer coping and place it back inside the impression in the same direction. So now I will give you a demo for closed tray impression. Fix the transfer coping. So now I will be making the putty light body implant impression for closed tray transfer coping. So our putty material, equal amount, has to be taken, manipulated and loaded in the tray. Properly till you get the uniform color, then injected inside the patient's mouth or all around the transfer coping. Bit on the adjacent teeth also, and load the putty over the teeth. That is the basic difference between open tray and closed tray. See, if it had been open tray, you have to make a hole in the tray so that this extension should come out of the tray, and while removing, we'll unscrew it from outside only, and we'll take it out. This entire thing comes out with the impression. Whereas in a closed tray, the hole is not required. That's why it is called as closed tray. After the material is set, we will take out the tray and we will unscrew the transfer coping from the patient's mouth and will manually put it back inside the impression. So that is the biggest disadvantage or drawback, what you can call. There is a chance of human error. So taking it out from the patient mouth and manually the operator has to, the technician or doctor has to place it inside the impression. So little bit orientation may change. But in your closed tray, in your open tray, it would be more precise. Why? Because you will be unscrewing it out inside the patient mouth only. When you take out, it will come out with the impression. So the chances of micro movement is less in case of open tray. That is the advantage. So whenever we are doing single implant or single 1 unit implant crown, then closed tray should be fine. Whenever we are doing multiple implants, more than 2 implants, 3 implants, always better to do with the open tray, as the chances of error is less. This component is called as lab analog. This is just like your implant. You can call it as a dummy implant or lab implant. The internal hex or the dimensions will be as same as your implant inside the patient's mouth. So this to mimic the implant, this will go inside the cast, inside the model. Over this you can fabricate a crown. So your patient's model will be same as the patient's oral cavity. The same position of the implant will be transferred, and this will act as an implant. Over this we fabricate a crown, and that crown will be transferred to the patient's mouth and it is fixed. Wait as per the manufacturer instructions till the material is completely set. Once the material is set, take it out from the your transfer coping is still inside the patient's mouth. Okay. As I told you, you manually need to transfer it. Unscrew it. And in the impression, you can see there is a same, like there is a flat surface and curved surface. So the same direction you need to place it back. So again, as I told you, disadvantage of closed tray is there is a chance of human error incorporation when you are trying to take it out of patient's mouth and placing it back inside the impression. Whereas your open tray will come out like a pickup impression with the impression itself. Now, before placing it, what I will do, as I told you, this is lab analog or dummy implant used for the lab. I will fix this lab analog to the closed impression post, and I will place this impression post inside the impression. Now it is ready to pour the cast. Now we pour the stone, the model is prepared. Okay, once the stone is set, impression is taken out, and how will you get the, how will your impression will be? So you will get the impression something like this. After the impression is set, you get the model like this. So, okay, so the analog what I had put will be inside the model, and this will be protruding outside, and then take out this from the model. Now the model is ready for crown fabrication. It is same positive replica of the patient's oral cavity. So wherever the implant dimension, implant position was the mesiodistal epidural, same thing is transferred with the impression post, and the lab analog mimics the implant. So now you need to place the abutment over it and fabricate a crown. This is about closed tray implant impression.